Hello everyone, I am Dr. Simran Rao, an oral and maxillofacial surgery resident, and in this video I am going to explain about childhood caries and how to prevent them. Now, what are childhood caries? They are tooth decay or the formation of cavity which is due to frequent consumption of sugary foods or lack of oral hygiene and due to bacteria. So it is a combination of various factors. Now what happens is that whenever there is bacteria onto the tooth surface, the body starts producing acids in the oral cavity onto the tooth. So this will weaken the tooth because it wants to kill the bacteria. Now that will lead to the formation of the whole spits that we keep on seeing. Now the symptoms that the child will start feeling is sensitivity. Then it will go on to visible pits, holes or blackish discoloration. Then later he will have pain while chewing. So all of this is due to childhood cavities or caries. Now with proper intervention, all of this can be avoided. But if no intervention is taken, then this will lead to tooth abscess formation. It will lead to infection, and the infection can also spread to the bones or the nearby other structures. Now, if there is early loss of tooth because of this infection, then it will also prevent the permanent teeth to take place of the milk teeth. Now, all of these issues in the child can be prevented by following proper tips and tricks which I am going to give you so that your child can be prevented of childhood caries or cavity. The few tips that I am going to provide to prevent childhood caries are: the first point is to regularly brush teeth. Now, this should be started when a single tooth appears in the oral cavity of a small child. There are usually brushes which the parent can wear on their finger so that their finger can enter into the child's mouth and brush their single tooth or a few teeth that come at that age. Now, as the child grows older, he or she should be encouraged to brush their teeth on their own. By the age of 7 or 8, they should independently brush their teeth. Now, brushing should include a fluoridated toothpaste, which should be a pea-sized amount, and it should be done in circular motion. This should be taught to small children. Now, the next point is they should be flossing at least once a day. Until they can do it for themselves, the parents should do it for them. And these activities such as brushing, flossing should be made fun, by singing or dancing to them, buying them cartoon shaped flosses or mint tasting flosses. They could also be bought the fancy toothbrushes so that it is made fun for them. Then the third point is a balanced diet. The child should be given a diet which is rich in proteins, carbohydrates, the good fats, and raw vegetables and fruits should be included in their diet. The snacks that should be given should be in the form of fruits or cheese or vegetables such as cucumber, carrots, rather than sugary food. Sodas should be avoided given to children because they will promote the bacterial growth and caries formation. Plenty of water should be given to children to drink so that their mouth remains hydrated, as well as the fluoride in the water will strengthen the tooth structure. Next point is to visit the dentist regularly. Every 6 months, the dentist should be visited so that they can look upon any small problems that have occurred, as well as give you the tips which is required for your child particularly. Application of fluoride treatment that is done usually by the dentist. So the children should be taken to the dentist so that they can give them the fluoride treatment. Now, for that, the patient should regularly visit the dentist. They will call you at an interval of 1 year, 3 years, 5 years, 7 years for the fluoride treatment, and this will help you strengthen your teeth so that the caries formation will be prevented. Sealants can also be put on the molars, which are our posterior teeth, over the chewing areas so that the bacteria cannot grow on those areas, and the formation of caries can be prevented. Then the second last point that is the very crucial is to lead by example. The parents are usually the role model of children, and they mimic whatever the parents do. So if parents will take care of their own oral hygiene, then the children will learn from them and will make it a part of the daily routine. The last point is to address small problems, because those small problems will not cause extensive decay if at all they are intervened at the proper time. But if they are ignored, they would lead to huge infections and abscess formation, which would be traumatic to the child as well as prevent the growth of the permanent teeth. In the end, I would like to say that safeguarding the children against these caries is very important for their overall well-being and oral hygiene. By the tips that I have given, these efforts will help equip the children with knowledge and tools so that they will have healthy smiles, and they can prevent dental problems even in their adulthood. Thank you.